Yo, what up, mofos? How's everybody's Thursday going so far? Today is July 23rd, and let's do some live streaming on Biotech news. What's going on? Lilly's triple G drug hits 22% weight loss, cardio impact unclear. D-O double G, triple G, Eli Lilly triple G. Oh, bruh. Good for you, Eli Lilly. Uh-huh. I mean, I think what is it called? Zepbound, right? Zepbound, and it's the Lilly drug or Wegovy. Wegovy is the Novo Nordisk one. Uh, Zepbound, I think already can reach something like it's definitely more than less than 22%. So if uh Zepbound already works, then why do we need a triple G drug? It not only works, the Lilly drug already works pretty well. So now you're gonna having people lose more weight. Isn't it just and also like with weight loss, don't you just take it longer so you would lose more weight? I I really don't understand. So like how crummy do you want people to keep feeling? It's not like these people are having the time of their lives being on these obesity drugs because they can't eat and they probably have other kinds of side effects, right? I don't know. I have never talked to anyone who's taken weight loss drugs, but it must not be a great feeling to not be able to eat. So, yeah, good luck to those that are just going to be taking the triple G. It's crazy. Let's see. That's a sponsor article. Roche drops lupus TCE, which stands for T cell engager, retains autoimmune cell therapy interest. Good for you. Well, India can build its budding innovative R&D moment. Scancell head to no, not Nasdaq, to Nasdaq via reverse merger with Euphoria. That's an interesting article. Let's see. Layoff tracker. Holy shit. It's that time of the year, huh? Australia's clean Nouveau sheds up to 20% of workforce in US move. Well, sorry, Australians. Good news, Americans, huh? House passes drug FDA bill to animal testing rules. Okay, I'll just open up that one. In the meantime, let's take a look what else is good here on Biopharma Dive. Yeah, the Eli Titty drug. Eli Titty. Uh, sorry, Eli. I don't know if you have titties, but your name's Eli Titty. The triple G drug is called. Doesn't that just look like retardedide to you? Retarditide. Retarditide. Yeah, it's not trying to imply anything about, or it's not imposing any judgment on people taking that drug at all. It's only called retarditide. So, yeah. Uh, Vertex was a sole bidder. Yeah, we read that story. Lung cancer drug. I think this is the Nuvalent or Nuvation drug. Uh, Best case scenario for fat lowering drug. Novo sues Lilly. We covered that one. AI's rapid ascent acquired by AI's giant Anthropic. Maybe this one's interesting. And we covered that story yesterday. Let's see. Let's see what's more interesting. Go through all of the news and then we'll pick one or two. Dying a new overweight at Cantor on platform for neuromuscular disorders. What does that mean? Palisades bio jumps following Oppenheimer outperforms initiation. Oppenheimer should be a fund, right? Or Oppenheimer is the nuclear bomb. Huh, who knows? Canton Strategic sells biotech arm as it advances Canton network strategy. B1 expands U.S. footprints with 300 million in investment in New Jersey. Arcus in supply deal with AV Oncology. That was yesterday's news. All right, cool. And Revolution Medicine, of course, that was also yesterday's news. Let's see what this means. A new overweight at Cantor. Initiated Dine and outperform, finding significant value in its Force platform. Eric Schmidt. Huh. Isn't this the CEO of Google? Or the guy's name's Larry. What's the dude's name? Ah, it's escaping my mind. Yeah. Google founders. Google founder Eric Schmidt. There we go. That's his name. Yeah, Eric Schmidt, former Google CEO. Larry Page. There we go. There you go. Larry Page and Sergey Brin, no? In Miami, property as billionaires flee California tax. Holy shit. Billionaire tax. Crazy. Wow, look how young these lads were. It's crazy. Good old days. There hasn't been that much spotlight on Sergey Brin, though. Why am I looking at tech news? Fuck that shit. Nobody cares about tech except for all of the investors in the world. Um, Eric Schmidt. Duchenne's muscular dystrophy. Did I do something on Dine? Yeah, I did. I did that the day before. So I did look at Dine. Okay. So, okay, Cantor Fitzgerald initiated coverage for the company. That's cool. Palisades Bio. Following Oppenheimer outperforms initiation. Okay, Oppenheimer is another investment bank, I guess. Cantor Fitzgerald is a boutique investment bank, and so is Oppenheimer. And I guess both of those two focus on life sciences. Um, what are we doing here? Oh, Dimension. Young venture firm has bet heavily on tech and biotech convergence. Has now invested in 35 companies. Recently saw one of them acquired by AI giant Anthropic. Nan Lee, Zavendar, and Adam Goldburn are the three CEO co-founders and investment partners at Dimension, which raised $800 million fund on January 1st. Young venture capital firm. General partners, Lux Capital, and Obvious Ventures. The name of the company of the venture fund is, or the venture company is Obvious Ventures. Can it be more obvious, huh? Managing director Nan Lee, the firm leaned heavily into what's referred to as the digitization of drug making. Many computer scientists as biologists. The focus has put dementia at the forefront of a dizzying sprint by drug companies. So which company did Anthropic buy? Isomorphic Labs, Chai Discovery have commanded multi-billion-dollar valuations, some of the year's largest venture funding. A recent report, Prevalence AI, New limit. Longevity startup. Which firm? Partaking in the cross sector. Chai led the Series A financing for longevity startup New Limit and participated in 787 million Series C for the AI-powered cancer and immune drug maker Randy Labs. Coefficient Lab right here has been I've seen one of his portfolio companies acquired too in April, a stealthy startup it backed Coefficient Labs acquired by AI giant Anthropic. That's interesting. Okay. Let's see about this story. Irindil Biologics China, an AI-powered drug maker, hauls in 787. That's a Boeing right there. Will support U.S. and China-based startup. A massive pipeline. What is this? Irindale, a high-powered startup with presence in China and the U.S. Secure biotechnology company, bankrolled, incorporated in Delaware, but it has offices in Beijing and is affiliated with Helixon Therapeutics. It's just backed by a number of Chinese venture investors, part of a fast advancing technology that increasingly attracting partners. Using artificial intelligence to develop next generation biologics for several diseases, from asthma to eczema, eczema. Yeah, there we go. The skin disease to colorectal cancer. It claims its technology has produced more than 40 programs overall, and it's on its website. It lists 19. Why 19? Why not like 119? Since you're only doing artificial intelligence drug discovery. One for inflammatory bowel disease is ready for phase 2 development. Several of these medicines are aimed for popular drug targets like DLL3 in lung cancer and TL1A in IBD. Many are bispecific antibodies, T-cell engagers, and dual targeting antibody drug conjugates. Stand out. Sure, it stands out. So what does it actually have? The original deal involved 2 drugs for IBD. First last April, when allied with the firm twice. This seems interesting. Irindale Labs. Anthropic. They bought it for $400 million in stock. Healthcare Life Sciences. Led by Eric Caldera Abrams. Company had stayed under the radar. Tweeted in January, part of a recruiting pitch. We're ushering biopharma into the intelligence age. Dimension is boasting 38.5% IRR on the investment. The partner from Obvious Ventures who found Dimension. Right. Hard not to marvel at the contrast between Anthropic's science-forward acquisition of OpenAI's media-oriented purchase in the headlines today. Okay. Cool. Got it. Not interesting from a biotech perspective. ScanCell to go public after winning reverse merger bid with Euphoria. Have made their union official via reverse merger, result in a NASDAQ listing for ScanCell and a resolution for Euphoria's shareholder. A London-based scan cell acquired Euphoria in all-stock transaction. The financing will be used to support a global phase 3 trial for ScanCell's lead asset, ISCIB1 plus, an immunotherapy for advanced melanoma, and has received fast track designation from the FDA. ScanCell, which plans to list under the ticker SCLT. Biotech showed phase 2 study 77% progression-free survival at 22 months when ICIB1 plus was combined with Bristol Myers Squibb's immunotherapy Yervoy and Opdivo. We believe that the compelling data this summer brought more bad news for Euphoria. So Euphoria wasn't doing great. Underwent a strategic review after Soclincicant, an alpha-7 nicotinic inhibitor negative allosteric modulator, failed to hit its primary endpoint in phase 3 trial for social anxiety disorder. That's a thing? Social anxiety disorder? Are you fucking kidding me, dude? You can actually make a business out of treating social anxiety disorder? Damn. Okay. Just never stop to amaze me. All these hustlers, you know. Euphoria had its fair share of suitors. Da-di-da. Okay. It's just not very interesting. I think the most interesting piece of news. Let's see. I don't know if this one is. Which one's more interesting? Arendelle or Palisades Bio? What about Palisades Bio? Set to enter phase 2 for ulcerative colitis and Crohn's disease. It's a PDE4 inhibitor prodrug that performed well in phase 1 trials. Asset set to occupy middle ground. UC still lack. J&J's Tremfya, like early relief paired with Opfazimod, like oral maintenance practically. Is Abivax oral inflammatory candidate with expected NDA filing for UC in Q4. More targeted, they could avoid the safety tolerability baggage of approved PDE4 inhibitors. Yeah, I'm just curious. I think from a biology perspective, this company is more interesting. Right here. Palisades Bio. And it went up 14% higher, right? What is story behind the founding initial funding investors behind Palisades Bio and its lead drug candidate. The founding history and let's see. Pali is a NASDAQ ticker. Pali. Origin as leading biosciences. Their roots traces to its roots in September 2011. It was founded as leading biosciences in Carlsbad, in the San Diego area. Commercialized technology aimed to protect integrity of the gastrointestinal mucosal barrier, preventing damage caused by the digestive enzymes. In 2021, Seneca Biopharma merger. They completed a reverse merger with Nasdaq-listed Seneca Biopharma. The transaction, they absorbed leading biosciences. The company was rebranded as Palisade Bio, trading on the Nasdaq under Pali. Initial investor. Alongside the merger, the newly created Palisades Bio secured $22.5 million in private placement funding. Altium Capital, lead drug candidate. Its lead candidate underwent a key strategic shift as the company pivoted from post-surgical GI recovery to chronic inflammatory bowel disease. The concept LB114 was an oral liquid formulation for broad-spectrum serum protease inhibitor designed to neutralize digestive system in the gut. Its current, after clinical trial hurdled with LB1148, they restructured its pipeline to focus on targeted oral prodrugs. The current candidate is Pali 2108. It's once daily. Engineer for local bioactivation lower. I have no idea what this means. It's all fucking jargon and it doesn't mean anything. Let's just ask, how was the drug Pali discovered? And funded. How about that? Seneca. The story from Seneca, because I believe this asset came from Seneca. Oh, did we just do this under Crystallis? Okay, whatever. We should have started a new chat. The active molecule, initially developed for over 8 years by medicinal chemists and formulators at the former Merck campus in Montreal, Quebec. The barrier. Molecule proved to be an exceptionally selective and potent PDE4 inhibitor. A Montreal-based biopharmaceutical company, Giant Biopharmas, repurposed the Merck compound by converting it to an inactive gut-restricted prodrug. Once the prodrug travels down. In September 2023, Palisades Bio entered an exclusive worldwide licensing agreement with the Giant Pharma. Under this agreement, they acquired the exclusive global right to develop, manufacture, and commercialize Giant's targeted prodrug platform, rebranding the lead candidate to Pali 2108. They're financed through a hybrid model, combining nonprofit grants, government tax incentives, and public market equity. IBD Venture Program. Pre-clinical phase at Giant Pharma, the program received competitive grant from the Crohn's and Colitis Foundation via its IBD Ventures initiative. Sounds like investment banking ventures, huh? IBD Ventures. Non-dilutive Canadian government credits. And Palisades Bio financing. Okay. I guess it's pretty interesting. Man, this is a really shitty disease to have. Ulcerative colitis. Huh. Well, let's see. Let's see how these companies are doing. And how are they currently hiring right now. So, ladies and germs, if you're looking for a job, you might want to consider applying to these companies because they have good funding. They just raised around. No, they didn't raise. Their stocks are higher. Okay. Let's see if these guys actually do any real R&D or just blowing hot air. Houses Bio. That's it? Okay, good. Our approach. Investors news. Are they hiring? About us. No, they don't have any careers page for see? They're not hiring. No? Approach pipeline. Okay, so these folks are not hiring. Good. And how about this company right here? Irondale. Palisades Bio. Irondale is actually the name of a Lord of the Rings character? Holy shit. How do you say his name? Pronunciation. Pronunciation. Can Google do it for me? No, it can't. Arendelle. 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 In Tolkien. Tolkien. JJ Tolkien. JR Tolkien, no? JJ, what's Arendelle? Arendelle. 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 AI? Biotech? Arendelle Labs. There we go. But it's actually not Arendelle, it's Erindale. Let's see. Do they have any careers page? They don't. All these lovely looking Chinese folks. Great. It's awesome. Looks exciting AF, you know? Right. It's just two people that have raised, look, they have raised $700 million. Are these the ultimate hustlers or what? Or what? Ho, 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 ho. Halls. Seriously, two people raised 787. Why are you guys not running for Mexico right now? Seriously. Huh? Look, seriously. They don't have shit right now. Oh god, like I can build a website like this, you know? Antibody sequence at massive scale. Yeah, right. My ass. This is just biggest bullshit ever. God damn. Oh, I mean, it's fine. The investors buy it. And I wonder why they buy it. It's just beyond my wildest imagination. Okay. Now let's finally forget about all these and just take a look at the patients and their TikTok stories behind UC, aka ulcerative colitis. Let's go to Instagram. See what we got here. Overhaul teen pregnancy program to focus on marriage, starting family. What is that? Cancel federal grants to organizations across U.S. that offer adolescent health and sex education classes. They accused the group of encouraging premarital sex, which organization rejected. Interviews, other directors also said the government had distorted their content. The grant cancellation for Fat Forward was the latest moves. Fact forward, huh? So fact forward is to have sex early. Well, that seems to be a pretty straightforward message. And I don't know why they need a federal grant for that. Um, don't you think that's what these teens are already thinking about anyway? Mm, anyways, let's see. Ulcerative colitis. Live with ulcerative colitis. Let's see what kind of results it's gonna generate. Who's this? Isn't this a Hollywood actor? What is this? Let's see. I wish I could know you much more sometimes. I wish you could know just me. Stomach pain or frequent trips to the bathroom, constantly standing where the nearest restroom is hinging plan. Without warning, relying on people around you more than you like. I wish I could know you much I'm sorry, dude. I wish you could know me. When my symptoms hit, my daughter waits patiently. Wait, that's his daughter? I thought that's his girlfriend. Dude, you look like you're 25. Just the plug. Jesse Leon, okay? Not every struggle is visible, not every foundation. Damn. And she's waiting in a guy's bathroom? My pet peeve is people saying, "Oh, I get stomach ache too." Let's see. Go ahead. The song is currently unavailable. Why? Alright, sorry, dude. I can't hear your story. Things help me stay happy even with IBD. Watch my breath through my ulcerative colitis pain. Ever present in my life. And the kids in the back. Oh. Yeah, so it's totally forgivable that you ignore your daughter in the back. Everybody has a condition. What is I'm more curious about this girl right here. But this is diagnosed with what? Surgery. Ileostomy. End up getting an infection inside my bowel, making me very ill and septic. Before I was rushed back for emergency surgery 5 days later. Had to give me I have 2 stomach bags. However, this one won't be as permanent as my normal one. So pleased to say today, first day since my surgery, that I feel so much better and stronger. What's her condition? Is it ulcerative colitis? Does she have ulcerative colitis? Yeah, she does. Dang. Wow. She's from the UK and she has to wear a bag, an ostomy bag. I'm sorry, girl. I know what that feels like. Well, I've seen it, but I don't know what that feels like. Damn. See, this is the positive side of TikTok. People sharing their moments. Autoimmune disease. Let's see.
I was diagnosed with an autoimmune disease called ulcerative colitis 7 years ago, which is kind of crazy to think about how that has happened in those 7 years. And in that time period, there is so much I have come to realize that I wish other people knew about living with UC. The first thing is that UC impacts everything. There is such a misconception that UC only impacts the GI tract, but it really creates full body symptoms of brain fog, fatigue, joint pain. So much more goes on that are not GI related. And speaking about fatigue, that is something else I wish people understood, is that being tired and being fatigued are not synonymous. They are not the same thing. So many times in the past 7 years, I have told someone that I'm super fatigued. They kind of come back with, oh yeah, I didn't sleep well last night. I'm also super tired. Not the same thing. When you are fatigued due to autoimmune disease issues, you truly are not a functional person, and no amount of sleep you get is going to make you feel better. And the third thing I wish people understood more is that UC is a dynamic illness, meaning it can look different every single day. There can be a day where I am feeling so good, especially at this point where I'm at my journey, where I can go to a dance class, or I can go to the gym, or go on a date with my partner, and the next day I could wake up so fatigued, so nauseous, not be able to eat a lot, definitely can't do the caffeine, and it can look like that literally from moment to moment and day to day. If you also have UC, I would love to know what you wish other people knew.
No, I'm not gonna comment. That's a clickbait. Yeah. Well, folks, Palisades Bio is working on a CDE4 inhibitor, and it might be like an asset that's been passed around several hands, went through several hands, but you know what? It might work, it might not, but who knows? Their stock jumped, so maybe they will get good data in their right phase 3. No, so phase 2, set to enter phase 2 right here. So Pali 2108. Good luck. That's it for today, and wish everybody a happy Thursday evening. Adios.